And welcome to our live stream. I'm Dr. Ara Deuk-Majan, CEO and founder of the Deuk Spine Institute. We are broadcasting a spine surgery live. It is the 6th of July, 2023. Our patient has very bad back pain. The back pain is localized in his lower back to this area here. And when I looked on his MRI scan, I realized he had 2 damaged discs. You might call them a herniated disc or a bulging disc, slip disc, protruded disc. There's lots of names. In the end, discs aren't that complicated. They're really an annulus fibrosus wall and a nucleus pulposus center. So he had these 2 discs, L3-4, L4-5, and I looked at him and I said, you know, that's got to be where the pain's coming from. So we decided to move forward with the Deuk laser disc repair, and we're going to go in and we're going to see those damaged discs, and we're going to repair them. Now, other doctors, none of them, might recommend a fusion, and yet other doctors might recommend an artificial disc. I would like to see 4-5. So just so you all understand, let's go ahead and get 4-5 a little bit better. I think we're off on WAG. Look at the bottom of 4. Try to fix that WAG shot. That's better. All right, so show the audience L5-S1, what we're calling L5-S1. So the first thing you got to do is a spine surgery. That's not 5-1. That's 5-1. Yeah. Let me just verify that. First thing you have to do, because everybody's spine is different in terms of the shape of the disc, what they look like, you have to have an MRI scan so that you know what you're doing, where you're operating. So I'm looking at the MRI. I'm going back and I'm just double checking. And certainly the L5-S1 disc is kind of what we call a pseudo disc or fake disc, and it looks normal on the MRI. And then below that is some more fake discs in the sacrum, which would be like an S23 disc. And you can see that full-size disc there. Yeah, there's the S23. Show us the L5-S1, what we're calling L5-S1, which makes the one above L4-5. And you can see the iliac crest runs through the middle of L4. So I'm comfortable that we're at the right place, but that's very important as a surgeon operating on the spine. You got to operate on the right level. All right, so we're a little bit higher than we want to be. Again, I want to move south a little bit, just a little bit. And I'm using my X-ray to guide me. None of them? All right. We're going to take a little bit of a steeper approach.
Little
shot numbing medicine.
Sorry about that.
All right, we're just giving you some numbing medicine. I know you'll feel a little bit of discomfort. It should start feeling better shortly. Our patient is awake for the beginning of the surgery, and of course, we will put our patient to sleep once we are where we need to be. Mm-hmm. Shot. All right, right on the facet joint. So my trajectory looks really good. I just need to be around the facet joint. Everything's fine. You can actually feel, what's quite amazing is around your facet joint there's some fat in everybody's because, well, you know, AP, fat is used as energy by your body. Everything in your body uses fat except for your brain. And so fat is a common energy storage form. And, you know, just like we as humans do, we store energy in the refrigerator, right? And some people have a refrigerator in their kitchen, some people have in their room, their bedroom, some people in their game room or their movie theater. basically you're moving the energy storage depot to areas where you use it. Well, your body's the same way. We're just following the design of God, who designed our bodies to store energy in places we need it. Okay? So I felt the fat as I went past the facet. We're now low in the foramen at the 4-5 disc. So I'm happy with that. Our next disc is going to be the 3-4. You okay?
How you doing, my friend? He said thumbs up.
Good. He's doing good. We can't tell you the identity of our patient or anything that could help you identify them, so we want to maintain some anonymity, but I'm happy he's agreed to share his surgery with all of you through the internet. And now we've made our incision. The incision for this particular type of surgery, called the Deuk laser disc repair, is 7 millimeters. You can easily see why we don't need painkillers after surgery, because the patients are doing really well with just a small incision. You don't need pain medication. Now the trouble I'm going to have is this other. You know what? Let's do this. I'm going to. I'll try one more time. If I can't do it, I'm going to put the guide wire now. That way I can move the head of the other needle out of the way. Shut. Because it's getting in the way of my navigation of the second needle. So I'm going to try one more time. Shot. That looks pretty good. Shot. It'd be nice because I do want to do a discogram. Again, I'm navigating past the facet. Shot. Just there. Perfect. We're there. So you can see I've navigated past the facet. There's, you can see the herniation. Jordan, show the audience the herniation on that lateral view. Henry, you see that shadow right there of the herniation?
Yes, we do.
Yeah, so normally you do not see, I could feel it. I feel it with the tip. Normally you don't see a herniation on x-ray, okay? Because x-rays aren't good enough to pick up herniations. But when you have the best x-ray machine in the world, you can see things that other x-ray machines cannot see, like herniations. Any questions from our audience?
No current questions.
Let's run our animation video on why do herniated discs like this actually cause back pain.
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
All right, well, now you understand why a herniated disc causes so much back pain. We're the first to discover that at Deuk Spine Institute and talk about it. And this patient has had back pain for 20 years in his lower back, 20 years. So basically his quality of life has deteriorated in 20 years, and he's having trouble doing anything productive outside of work. And he wants his quality of life back. So we're going to verify that these are the discs causing his pain. Are you comfy?
Comfortable? Yes.
All right. Any pain?
No pain.
How bad is that on a scale of 1 to 10?
Here's a number. You can speak out loud. 6.
Is that where you typically get pain?
Yes.
Okay. Well, you can actually see he has almost no tear, and he has 6 out of 10 pain, and it's concordant. So 6 out of 10, and it's almost cotton ball. There's a small tear, so it's not going to require a lot of work, which is good. Is the pain gone?
Is there any more pain left there? No, it's gone.
Yeah, and part of the reason why you don't get a better tear with dye coming out is that he's clearly got a herniation. You could see it, but there's a lot of scar tissue blocking the dye from leaking out. Are you comfortable? Good? Berndes?
Yeah.
He's good?
Yep.
How bad is that on a scale of 1 to 10?
Here's a number. He said a 10. That's a 10.
Is that where you get pain?
Yes.
All right. We can put him to sleep.
We're going to go nice and
So the first disc, the 3-4, was a 6 out of 10 concordant, and the 4-5 was where most of his pain's coming from. We're going to fix both. Which one do you want to start with? The bottom one? We're going to start with the more painful one. All right. Any questions from the audience?
No current questions.
Let's go ahead and show our audience what the Deuk laser disc repair actually does. So far, we've lost about 3 cc's of blood, maybe 2 to 3 cc's of blood. So maybe 40 drops of blood, if that, maybe less. So you can see it's pretty much bloodless surgery. All right, let's go ahead and we're going to take out this needle. Are you on with the video?
No, not yet.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Welcome back. Now you've seen our video on how the Deuk laser disc repair fixes back pain from a disc using the laser. We're now advancing the dilator through the disc, through the tear. So people ask me, doesn't this damage the disc? It does not, because we're actually going through the tear itself that's already there. Okay? If we were going through a normal disc, then yes, it would probably do some damage. But because we're actually going through the herniation and we're pushing the herniation back in, where we can take it out from inside the disc, like we saw last surgery. So it does not damage the disc at all. Now, while I'm doing this, I'm watching on the x-ray to make sure that my tube ends up where I want it, which it looks pretty close there. Yeah, we're in. Now we can take the dilator out, and we're going to do the entire surgery through this tiny little tube here. It's basically no bigger than a shake straw. If you've ever gone to Shake Shack or McDonald's and had a ice cream shake, you can see how small this tube is. Okay? The whole surgery is done through that tube. Any questions?
No current questions.
Okay, we're going to head in with our scope, and now at the bottom of the tube, everything good? You can actually see we are inside the disc right at the bottom of the tear. So we're right where the tear ends. You can see the walls of the annulus, the white stuff on the sides, laser. And all right, we've got our laser fiber. Can everybody see the blue laser fiber?
Yes, we can.
Great. So for those of you who are wondering about the size of things here, the laser fiber is a glass fiber. You can see the glass sticking out the end right there. And it's literally 1 millimeter wide. So that tells you how big everything is down here. You use it for scale. Okay? And basically, the laser energy starts at a machine here in the operating room where it's created, and it's sent through this glass fiber. It's about 10 feet long, glass fiber, from the machine to the end right here where it comes out. And then I direct the energy into the annular tear to do the debridement. So it looks like the glass is touching things and they're disappearing, but the glass itself is not. It's actually releasing energy onto the annular tear and the herniation. The blue stuff is herniated disc. It's degenerated herniation. And we're just going to keep removing this abnormal disc material that's herniated and cleaning up the annular tear. Now, I'm as deep as I really want to go. I don't want to go any deeper. Luis, this scope's lenses are definitely distorting. Yeah. So is this one, what's the situation with this one? Yeah, let's look at it. We may have to have it. I want to make sure the repairs are being done that are lasting. So they're expensive, so we got to make sure they're lasting. See how just a little bit of pressure is warping? All right. Any questions from the audience?
No current questions.
Great. This should be a relatively quick case. There's some scar tissue there. You can see some calcification called dystrophic calcification. Yeah, this disc will probably be the longest one. I think the next one will be quick. It looks pretty intact. We'll probably clean out a little scar tissue, some herniation. And then should be done. Yeah, definitely see it. Some as I pull just gently, we're losing the focus. So the lenses are definitely shifting. This has to be sent in. Can you find any more of these online? Yeah. Find them. Buy them. Because we're going to need it for the new facility as well. So let me know what you're finding. As long as they're a good price. Let's get some more. Because lumbar is so common, you know. Look at the tear right there, guys. See the tear, the blue? So the blue dye only stains herniated discs, herniated nucleus. And you shouldn't have nucleus there. That's the annulus. The annulus is white. Now you shouldn't have any nucleus within the annulus. So the fact there's nucleus that's from the center of the disc found within the annulus, it means the annulus is torn and the nucleus is herniated into the annulus. And that's a herniation. This is annulus right here. You can see some of it is calcified from inflammation, dystrophic calcification, damage to the annulus. It's your body's response somehow of trying to repair the tissue. For some reason it deposits calcium called dystrophic calcification. Any questions? Just about done here. This is the outside of the disc right there. See some granulation tissue right here? That's where all the painful fibers, nerve fibers are. Granulation tissue is basically young inflammatory tissue. It's blood vessels and nerves, new nerves to an area as your body tries to rebuild. Remember, any kind of injury you have in your body tries to rebuild it using inflammation.
No current questions, by the way.
Thank you. We have viewers.
Yes, we do.
Excellent.
Yeah, well, plenty.
Stream is good.
Stream is good. Everything's running good. No
Excellent.
complaints here.
All right. Well, if you don't have questions, it means you're satisfied with your knowledge. If you do, ask them. There is no bad questions. Right? Every teacher says that. It's true. No bad questions. Our goal here with streaming is to teach people about spine problems. So because the surgery becomes truthfully a bit monotonous, it gives me time to do and think about other things. Now, you know, when you're driving, you do the same thing, right? Like when you first start driving a car, it takes 100% of your attention. But then, after you've been driving for a few years, you get comfortable in the car. You still do everything you're supposed to do, but you get to a point where you could do like carry on a conversation or even make a phone call and talk to somebody while you're driving. So surgeons are the same way with surgery. Once we do a surgery, you know, hundreds and hundreds of times, there are parts of the surgery where we don't need our full attention. We have a lot of extra RAM that we could put towards other tasks, you know, just like a computer. And so I decided years ago to put my extra RAM towards teaching while I'm operating. Because honestly, I'm not the first person to teach while operating, right? That's how all surgeons learn. Surgeons go and do a residency, and during our residency, our teachers, our professors, neurosurgeons, they teach us while they're operating. They answer questions, they talk. So I just took that same principle and brought it to YouTube, Facebook, LinkedIn, Twitter, and decided that I would teach you guys instead of residents, since the residents aren't interested in learning. They already know everything. All right, here we have, again, I'm looking for the nerve root and the foramen, but it's surrounded by some fat and soft tissue. I want to make sure I'm not leaving any herniation below the root that would crush it or push on it. Is Our Lady ready to go? First patient? Good. Yeah, she looked pretty good when I was there. She looked like she was still a little dizzy and sleepy. Vitals are good? I know. I'm not complaining, I'm just making sure she's good. She's good? Vitals are good?
She voided 380.
Yeah. All right, we're pretty much done here. I don't really see anything else. A lot of scar tissue near the surface of the disc, but looks good to me. I think his back pain's going to be gone. The next disc is not going to be that bad, I don't think. That's my prediction. I could be wrong about it. But to me, the next disc looks pretty intact. And you can see it's causing less pain than this one. Let me just take one last look. So once again, the nerve root's going to be up there in the fat. Let me just get a little more of that cleaned up. That's a little more foraminal ligament, annulus, and disc material, herniated, degenerated disc. We're literally right below the nerve root in the foramen. This would be her, or his, right, what disc are we at? L4-5? So the right L4 nerve root in the foramen. Just making sure there's nothing left that's going to pinch it. Okay? And it's looking good. Little fat right there. We're done. All right, if you have questions, don't be shy. Ask them. We're here to answer your questions for you.
We just got a question. This comes from B3 on YouTube.
B3, welcome back.
And they asked, how are you doing, Doc? Thank you for all you do.
I'm doing quite well, thank you, and I appreciate you asking. We are going to have some busy weeks ahead of us because we have a lot of patients who want to come and get these procedures done. So we're just talking about the schedule earlier, and you guys can expect to see a lot of good surgery, spine surgery, of course. We are now performing the Deuk plasma rhizotomy on people with chronic knee pain. So if you guys know anybody with knee pain that's been recommended for a new knee, an artificial knee, they don't need it, come to Deuk Spine and let us see if you're a candidate for a minimally invasive procedure to fix knee pain. We've tested it out on almost 10 of our patients and employees, and they're loving it so far. Great results. Yeah, doing good. So we're going to finish here with the, come on in, with the L4-5. Then we're going to move up to 3-4. I think, if I'm not mistaken, 3-4 should be pretty quick. How did that come up? See that? Let's get the x-ray in here. Strange, huh? Could be. But why is the cross on that screen?
No, it wasn't for a moment.
Oh, but it wasn't on that screen. That's right? Am I imagining things? Somebody get Monica here. No, I'm just kidding. Yeah, I gave Monica a hard time. Shot? Okay, good. So we're done with one disc. We're ready to do the other. We're going to take the stylet out. We're going to run the guide wire down through the needle into the disc. You can see it there. Luis, will you hold pressure here? We always put some pressure on the muscle where we just did the surgery because muscles can bleed a little bit if you tear a vein, and muscles are full of veins. So when we put that tube in, we usually tear a little bit of a vein or two. So we want to put some pressure on the muscle. Num. I got this. And the reason for that is to basically stop any bleeding. Now for those of you,
Dr. Young was asking the concentration of the number.
concentration of the num.
Is that UP with Lido? 2%, right? 2%?
Shot. All right. Shot. Yeah, we try not to get any around the nerve root, but sometimes we do, but rare. In that case, sometimes the patients have a numb foot afterwards. But generally the concentrations and technique we use, we don't get that because I'm not putting numbing medicine down by the nerve root in the foramen. But in somebody like this who we're being a little bit more generous with the numbing, they can have, all right, we can take the guide wire out. They can have obviously some numbing. Shot. All right. Good. So, all right, B3, thanks for asking. I'm doing well. The team is doing well. We're busy these days in a good way. How come we have two tubes?
Yeah, I have
It's okay?
Yeah, it is.
But thank you for asking about me. I'm excited with all the new stuff we're doing and how we're fixing people without major surgery, you know, without open back surgery, without damaging their spines. It's pretty incredible, to be honest with you, that I'm part of this. I consider it a true blessing, because how many doctors in their lifetime get to discover things that actually help a lot of people get out of pain? It's special, you know? So I feel blessed every day. I told you people, my wife always talks about me retiring, but I'm not retiring. I love what I do. And I can't even think about retiring, because I can't imagine a life without doing what I do. I would be bored out of my mind.
If you retired, I'm in really bad trouble.
I'm not retiring. I honestly think I'll work till I'm dead. I mean, there are a lot of neurosurgeons working nowadays, even though they're old,
Right.
like 70, because I hate to say it, they didn't plan very well,
Thank you.
and they have issues. You know, they need money. Let's face it. I mean, doctors aren't always the best at planning.
Well, sometimes it's things out of their control.
Well, I know a lot that are working because they have to pay bills, whether it's kids in school, or it's loans that they borrowed money, or it's malpractice. I mean, neurosurgeons, if you can get a very expensive tail, you know, you can have $100,000 tail policy, and you're going to have to work and make that money to pay your tail, right? Yeah, the insurance companies a lot of times will hold you hostage and make you pay a lot of money. But I see myself not working because I need to for money. I see myself working because I love to do what I do. So I've lost 40 pounds. 40 pounds now? Yeah. I've lost 40 pounds in the last year and a half. So just taking it slow, doing it right.
The software is working fine?
Mostly eating less.
Yeah, okay.
And I want to be around for my kids. I want to be around for my patients. So, yeah, I've got motivation. And I'm getting busier, so I need stamina. It's just good to be healthier. Trying to look like Luis. I can't let Luis get all the chicks. Just kidding. Just kidding. Don't let my wife hear me say that. All right. Any questions from our audience?
No current questions.
All right, very good. Well, this patient we're almost done. Now I want to point out to you guys, this is important. Some of you who've watched our surgeries a lot, you saw the discogram at L3-4, this disc. Remember, it looked normal, like cotton ball they call it, right? Almost completely normal, like 98% normal. Most surgeons would look at that and go, no, there's nothing wrong. But once you get inside the disc, what do you see? You see the same things we see everywhere. The blue stuff, meaning there's damaged nucleus. You don't get damaged nucleus normally. It's not normal. So the blue should not be there. It should be white. The whole disc should be white if it was normal. So even though the discogram didn't look bad, there's still evidence, strong evidence, 100% evidence that there's an injury to this disc. And it's actually a pretty big injury. So we call this internal disc disruption. And I didn't discover internal disc disruption. It was described a long time ago by people much smarter than me that figured it out. The disc will look normal on an MRI or X-ray, but it's causing pain because it's like internal damage that you can't see externally. And now that we do endoscopic surgery, you can see all that damage. All this stuff is abnormal, all the blue. Shouldn't be here. This is all damaged nucleus. Go ahead. All these are pieces of herniation, by the way. Little ones.
We have a question from Severin on YouTube.
Hello, Severin.
They ask, hello, the main issue for patients with spinal problem is, of course, pain. But do patients with cervical spine problems complain about tinnitus? If so, does surgery help solve this problem?
Yeah, great question, Severin. Tinnitus is ringing in your ear. So tinnitus or tinnitus is a medical term, and it refers to a ringing or sound in your ear. Okay? Doesn't have to be ringing. It could be a pulsatile tinnitus. It could be different kinds of tinnitus, different kinds of sounds. But it's a sound that you hear. And tinnitus is never caused by the spine. A lot of people talk about it on Facebook. They talk about it having tinnitus and having spinal stenosis. But no, it doesn't cause tinnitus. Now, that said, I've had a couple of patients that had tinnitus. They told me it went away after surgery. So, is it possible? I guess it is, because I'll be honest with you, we don't know everything about the human body yet, and there are deficiencies in our knowledge base. But from all my teachings that I know of, there's no basis for tinnitus from the spine. Okay? The tinnitus comes from a problem with near the inner ear, and that's very far away from the spine. So, I could be wrong, but you asked my opinion, and I will tell you I don't know 100%, but if I had to say 90%, tinnitus is not related to the spine or spine problems. Maybe 10% it is, but how it is, I don't know. I'm just leaving that open in case somebody discovers someday something brilliant and does some kind of experiment and proves that the spine can cause tinnitus, spine problem. So, but everything I know about neuroanatomy, neurophysiology, neurosurgery, and the ear, there is no connection between tinnitus and the spine that I'm aware of. So if there is, it's not part of my knowledge base. And that's entirely possible. So I'm surprised how badly this disc is damaged compared to the discogram showing it looks so good. This is all calcium and scar tissue from damage, chronic inflammation. Yep, 5 minutes. 5 minutes, doctor? Yeah. All right. He's got the best anesthesiologist right here. Two of the best anesthesiologists. That's right. We have our visiting anesthesiologist from Michigan. Oh, actually from Nevada, but who was trained in Michigan. Right? Where did you do med school anyway? In Iowa. So Iowa to Michigan for anesthesia. Yeah. Nice. Right, did you grow up in Iowa?
I grew up in Scottsdale, Phoenix.
Oh, Phoenix. So you grew up in Phoenix, went to med school in Iowa, yeah. And then ended up in Michigan for residency, and you've been practicing your whole career in Nevada?
For 26 years.
Wow.
I was there too, the same group.
Yeah. What drew you guys to Nevada?
Necessity. There were canceling surgeries.
Can't, huh?
There were canceling surgeries. There was no anesthesia.
Oh, in Nevada.
Yeah.
So good job opportunity, basically. I thought you put the sin in Sin City being over there.
Me moving there?
I didn't. I told you we had an anesthesiologist years ago when I first started doing these, 16 years ago, and he would do resuscitation for people in Vegas. He would travel there and they would go drinking and partying and getting dehydrated, and he would go around with his vehicle, like I can't remember, like a kind of RV or something, a bloodmobile, and he would resuscitate them.
Yeah, hangover heaven.
Yeah, and he was doing it back when they were first started doing it, you know, like literally 16 years ago, 17 years ago. I guess so many people would end up in the emergency room dehydrated that they said, hey, well, let's bring the emergency room to the people, right? And save them the cost and trouble of going to the ER and being embarrassed and having drug tests run, right? Guys, you get drug tested in the ER too, and you can get in trouble for that. So it makes sense. I see why these guys exploded, you know? Berndes is getting ideas. I see the wheels turning in his head.
No, I'm trying to remember that anesthesiologist's name that's bothering me. I should know.
Who?
He's out in my gym. Sitting right next to me.
All right, we're done.
Lights on, please.
All right, if you have questions, feel free to type them up, scope off. And by the way, you can see all the little pieces of herniation here. You guys see all this here, Henry?
Yes, we do.
Just all these little pieces that float out. Okay. All right. Yep. We're going to put a little betadine developed just around the corner at NASA. Okay. And a little antiseptic. Surgeons like to irrigate at the end of their surgeries with a little antibiotic or antiseptic. Been doing it for, 100 years. And we used to use something with bacitracin, which was a really good antibiotic to give, but then I guess the FDA kind of said, nah, don't do that. People are getting it in the muscle, and it's causing some problems. So they kind of stopped doing it, fell out of favor. So we've switched to betadine in our irrigation since. Lay still, we're all done. You're doing great. What do you want, a staple?
I got it over there.
Okay.
Your back is fixed.
Your back is fixed, all done. Yep, go ahead. All right. So let me know when you're ready. Oh wait, let's show the audience how big the incision is. So we fixed 2 discs. Okay, you guys see this?
Yes, we do.
7 millimeters. Let me have that tape measure. You got it? This is a tiny, tiny little 7 millimeter cut. You guys see the centimeters here?
Yes, we do.
Maybe it's 8 millimeters. So I went big today. Here, thank you. All right, type up your questions for me. I'll come answer them for you face to face. Great job, everyone. EBL, I'm going to call 2 mil. Thanks, Henry. What's next? I'm Dr. Ari Deuk-Machen at the Deuk Spine Institute, here with a patient from Virginia who came out to the Deuk Spine Institute yesterday for surgery, and we fixed 2 discs in his lower back. You were having back pain for some time. Do you still have that same back pain?
No.
Gone.
I feel my back feels 100% this morning. I was able to sleep in the bed, laying flat for the first time in 2 months. I was sleeping on the couch for those 2 months, and I did not get good sleep at all. So I feel great in my back.
Good. Well, that's why we're here. We wanted to cure your back. I'm Dr. Ari Deuk-Machen at the Deuk Spine Institute, Here with a patient from Virginia who came out to the Deuk Spine Institute yesterday for surgery, and we fixed 2 discs in his lower back. You were having back pain for some time. Do you still have that same back pain?
No.
Gone.
My back feels 100% this morning. I was able to sleep in the bed, laying flat for the first time in 2 months. I was sleeping on the couch for those 2 months, and I did not get good sleep at all. So I feel great in my back.
Good. Well, that's why we're here. We wanted to cure your back pain and give you quality of life back. What was life like living with that back pain?
Any day you'd be like, it could happen today. I could go down with back pain, severe back pain for a week. And that happened. My first pain started about 5 years ago. I was working in the flower garden. I went down with severe pain. I was down for probably a month that time. And ever since then, it was just like randomly, just out of the blue, I'd go down for another week with severe back pain. It was just no way to live because I knew every day waking up it could happen today.
Yeah, it is no way to live because then you got to be careful every day. You don't set it off. You're worried about it. You're thinking about it. It takes control of your whole life, that back pain. His back pain happened to be coming from 2 discs. And did you see any other doctors? Did they recommend treatment for you in Virginia?
Yes, I was seeing chiropractors for the first number of years. The first chiropractor, he put me on this decompression table, and he would, pull you apart. I did that for 6 weeks. I felt a little relief at first, but it didn't last very long. And I've been seeing just regular chiropractors throughout the years as well. And then when this happened, I saw an ortho doctor. He did not recommend surgery. He recommended physical therapy. He said surgery is like a coin toss. It either works or it doesn't. And that was not good enough for me. I needed a little bit more reassurance that it's going to work. That's when I started looking for other options. And I had a lot of time on my hands. I did a lot of research and I found Dr. Deuk here. And I started watching his videos and testimonials. Made up my mind right there. It was without a doubt. That was my choice right there. I submitted my MRIs, and within 2 days, I did my virtual consultation with you. And 10 days later, I'm here.
Yeah.
And it's amazing. I had an appointment with an orthopedic doctor in Charlottesville, and that was February the 2nd for my first visit, just for a consultation. And who knows how long it would have gone after that.
Years.
Yes, I'm done now. It's just I'm back to recovery.
Yeah, the problem is, unfortunately, the vast majority of doctors treating back pain don't know how to cure it. They just don't. And if I had to put a number on it, I'd say 99% do not know how to cure back pain. It really comes down to 2 things. You have to make the right diagnosis. Where is the pain coming from? Most doctors really don't even know it comes from the disc, and that's where it comes from about 90% of the time. Then the second problem is knowing how to treat it. And the treatment that works, the only treatment that works, is surgery on the herniation, really. And there's 2 surgeries that work, fusion and the Deuk laser disc repair. I've done fusions for years. I've cured people's back pain with spinal fusions, but that's a big, bloody, messy surgery with screws, rods, cages, long recovery. You're on opioid painkillers for months, like 3-6 months, just taking painkillers, just getting over the pain from the surgery. Not the back pain, pain from the surgery. So when we started doing the laser surgery, people weren't having any back pain afterwards. They'd have just a little discomfort for one night. We realized they didn't even need the opioids anymore. So our laser patients don't get any painkillers except Tylenol and usually 1 or 2 Robaxin. So you did it. You happy you did it?
I'm very happy.
Yeah. And you can see in the surgery that we did, we actually got into your disc. We used the laser to clean up those tears at L4-5 and L5-S1. Surgery went really well for you. We didn't have any problems. It was just a tiny Band-Aid incision on your back, and that's why you went home an hour later, and that's why you're here today ready to go home. Where are you guys heading back to Virginia?
This afternoon.
Driving?
No,
Flying?
we're flying.
Flying out of Orlando?
Orlando.
Awesome. Anything you want to say to your friends and family and people you know out there?
Yes, living in pain is hard. It's not a way to live. And I recommend Dr. Deuk any day.
Well, thank you. I appreciate that. You had faith, and you're going to be rewarded for that. Congratulations.
Thank you.
All right. Good to see you. And good morning. It's Cinco de Mayo here at Deuk Spine Institute. It's May 5th, 2023. And I'm sitting with one of my patients who traveled from Ohio because he's been suffering with back pain for many years, as well as pain down his leg. And I'm going to let him tell you about that in a moment. But first, how are you feeling today?
Feel excellent. My back pain's gone. Feel like a new man.
Awesome. And your leg?
Leg, I just have a little cramping yet from walking off out of Kelder for so long. I'm compensating for my back, so I've got to work through that a little bit. Yeah, we knew that would be, but the back is excellent.
Good. And how long did you have back pain for?
25 years ago, I did some stupid lifting and bulged discs out and then just lived with them. I didn't want to do conventional surgery, which I'm glad now that I was always waiting on a less invasive surgery. And when I got reading about the doc, that what he did and the procedure and all the success rate, just thought I did a lot of praying about it, actually.
You were offered other surgeries and you chose not to do them.
Yes.
That was smart.
Yeah, I was afraid of conventional surgery.
And what convinced you that the Deuk laser disc repair endoscopic surgery, which you can actually see right here in the video, was done with a small incision on your back, 7 millimeters or 8 millimeters. What convinced you that was the right treatment for you?
Well, because I didn't want to be tore up from, a big wide incision and all the cut muscle and the scar tissue that probably was going to end up with. I've heard about, saw a lot of people in my business come in, hardware store, that had surgeries, and some were better for just a little bit and back into surgeries again, and just never ending. It seemed like once they started, it was never ending. So I was looking for something that was totally different and perfected.
Definitive.
Yes.
So you can move on with life.
Yep.
What's life look like for you now that we fixed your back?
It's good. I want to get back to normal activity, use my head, not abuse myself like I have over the years with working with masons and plumbing and water heaters and a bunch of massive lifting all my life. Just going to try to live a good retirement life and work light and keep on going.
A lot of surgeries that are done on the spine require patients to take powerful narcotic painkillers afterwards. Are you on narcotic painkillers?
No, nope. I took one Tylenol this morning because I'm going to be driving 3 hours, and that's all I've taken.
So basically the result of no pain in the back, it's not because we're covering it up with medicine or anything.
No.
Yeah.
No.
That's
I rolled
right.
over in bed at night and it was unbelievable. I laid awake for a couple hours just thinking about the amazement of it.
Praise God.
Yeah, for sure.
Well, is there anything else you want to share with your audience?
I just advise anybody that get an MRI and send it. It sounded goofy doing it online, but it sounded like it was too good to be true. But as you read about it and what he's done, it's the real deal. Yep.
Congratulations.
Yep.
You
Thank
had
you so
faith
much.
and it's paid off for you.
Yeah.
Enjoy yourself.
Okay.
You have a lovely wife too who's been very supportive. I know she's been suffering along with you,
Oh,
right?
yeah.
As spouses often do, watching their spouse suffer every day with pain. And I know it's been hard on her.
Yeah.
And she's such a positive force in your
Yeah.
life, I can tell.
She is.
She's got a lot of good energy there.
Yeah. 44 years of it.
Well, you take care, sir.
Yep. Thank you.
Enjoy life.
Thank you so much.
You're welcome.
Yeah.
Good morning, I'm Dr. Deuk Machen. I'm here with a patient who traveled from California to Deuk Spine Institute here in Florida for back pain that he's been suffering with for about 7 years.
Yes.
He's a father and he takes care of his family. It's been really hard for him to do so. He's actually gone for surgery already in the past. I think you had 5 surgeries done.
Yes, I have 5.
And that was done at elsewhere.
Yes.
We won't mention. You can say the name. Go ahead. Tell us your story. We want to hear it.
So I'll say this quickly if I can. So I come from San Jose, California. I had several procedures in the beginning of the year by the Bonatti Spine Institute here in Florida.
With the hope that it would get rid of your back pain.
And it did not.
It did not.
Everything they said they were going to do, they did the opposite. If anything, it left me more physical and I want to say mental pain.
Horrible back
Oh,
pain.
very. It's an understatement.
And you have a child that relies on you. You have a family that relies on you to be healthy.
Absolutely. I have a 19-year-old autistic child that me and my wife take care of And I mean, I can go on and hours about that, and it requires my help. If not greater part of the day, I'm also a business owner of a painting company in San Jose, which my employees rely on me. So long story short to all that, a lot of people rely on me. If I cannot even stand or sit up for any time of the day, I feel useless. Stabbing pain in my back, my lower back, my buttocks to my legs, it was just there constantly. I had my surgery done yesterday. Dr. Deuk here took it away. It's gone. I feel a little bit of my surgery stuff, but other than that, I don't even really feel that, to be honest with you.
And I hope you enjoyed the testimonial. I'm sorry I had to cut it short. We're going to answer a few questions from the surgery. We've just completed fixing 2 discs on a patient who is local to our area in Florida, and he has been suffering with back pain for 20 years. And when I went in there today in the surgery, if you rewind, you'll see it. We tested 2 of the discs that I thought were causing his back pain, and both of them were causing the back pain. But what was interesting is the bottom disc looked like a typical disc that we see with a tear and dye leaking out. The upper disc, the dye was pretty confined, what we call cotton ball. And so most surgeons would not operate on that disc because it's cotton ball. But he did have concordant pain at that disc. And I've done this long enough, I know that you cannot rely on just one test to determine where someone's pain is. MRIs do not tell you where pain comes from. Discograms are really good, but you don't want to be doing discograms on everybody just willy-nilly. You want to make sure you have what's called in the business a high index of suspicion. High index of suspicion of which discs are causing the back pain before you go sticking a needle in someone's spine and testing the disc, because that's invasive, could cause problems. So what we found by testing the 2 discs we were planning on operating on is that the bottom one was more painful, the top one was still painful, not as bad, but they both caused his daily pain. But we fixed them both, and I think he's going to do fantastic. He's in recovery right now, starting to wake up. We've got the next patient coming, who is from Georgia, I believe, right?
Okay, yeah.
Georgia. And he's getting a Deuk laser disc repair at bilateral L4-5, left 5-1, and a Deuk plasma rhizotomy to treat facet pain, right L4-5, right L5-S1, and he's getting a sacroiliac joint Deuk plasma rhizotomy. So for those of you who don't know what that is, we've not talked about that before very much, but there are people where your spine comes down and connects to your pelvic bones. You have a left and a right sacroiliac joint, this being the sacrum, this being the iliac wing, sacroiliac joint. You've probably heard about it. It's a common cause of back pain, and doctors are now recommending fusions for those problems. We don't recommend a fusion. We discovered a new way to fix it using the Deuk plasma rhizotomy. We go in and kill the pain nerves. So we're going to do that for this next patient. We did it for the first patient from Canada, and she's doing fantastic. We're going to do it for the next patient as well from Georgia. All right, we'll take questions.
These next questions all come from B3 on YouTube. First question being,
Hi, B3.
is it possible that the position a patient takes during MRI imaging adds to and or is the error during diagnosis?
So B3 is asking about MRI, error of diagnosis, and positioning of the patient. The answer is no. The error in the diagnosis is 100% the doctor's fault, not making the right diagnosis. And the reason, B3, is complicated, but a lot of it has to do with, honestly, the fact that we discovered that back pain comes from the disc. So we have to get the word out, and I've been trying, believe me. Most doctors believe that back pain is called nonspecific, literally nonspecific. So nonspecific they call it fibromyalgia most of the time, meaning we don't know where it comes from, it's just there. And therefore the treatment should be pills, shots, therapy, things that we don't know if it's going to work or not, but that's all we got. what we've done at Deuk Spine is we've figured out the exact target of back pain in every patient. And I can tell you this, it changes. We may fix 2 discs in a patient right here, and then the patient will come back a month later and they've got pain up here. And now it's a different disc. So we have to go fix that to get rid of their pain. So what I've learned over the years is that, number one, MRIs never tell you where pain comes from, ever. The patient tells you where pain comes from. And if you don't use the patient to help you as a surgeon, if you don't use the patient's information to tell you where the pain's coming from, you will never figure out where their pain's coming from, okay? And patients will continue to have surgery that doesn't work. So the first step in curing back and neck pain is the right diagnosis. And that takes tremendous skill, experience, and it takes shots sometimes called blocks that help us figure it out, discograms sometimes, and just honest to God, good clinical skills, which is lacking everywhere, and patients are not getting their diagnosis.
Next question from B3, asking, also during physical examination, what if the patient's feedback is not accurate? How do you check if the pain is local or radiating from an adjoining area of the spine?
Hey B3, great question. Very insightful, very important question. So you're right. If I have a patient in front of me right now, the first thing I ask them, do you have your pain right now? And if the answer is no, I don't have any pain, then I either would be inclined to tell them, well, what makes your pain come? And if they say walking, bending, twisting, I'll say, go walk around the hallway. Bend over right now a few times. Let's get the pain coming. I need to know exactly where it's coming from. So I actually have the patient, if they don't have the pain right then and there, I have the patient do maneuvers like bending, twisting, lifting, walking, that will elicit the pain. And then they come in, and when they show me, all right, I have the pain, it's right here, I'll put an X on that spot. All right, where else do you have the pain? Over here. Okay, I'll put another X. So by the time I'm done with my exam, I can clearly have mapped out where their pain's coming from. The most important thing doctors need to understand is that the pain is not non-specific. And honestly, I hate to say this because people are going to hate me, but there is no such thing as fibromyalgia. It is fake. It's not a real diagnosis. You're going to hear it for the first time, probably in your life, from me. And I stand behind it 100%. There is no such thing as fibromyalgia. Okay? It is a diagnosis doctors give patients who have back and neck pain where the doctor does not know the cause. So they say you have fibromyalgia. What it really is for the patient is a death sentence, because what they're saying is, we don't know where your pain's coming from, you're going to live with it the rest of your life. When in truth, every single fibromyalgia patient out there, I will tell you exactly where the pain's coming from. If you line them up in front of me, I will tell you, every single one of them, where's their pain coming from. And then I will cure it by treating that exact spot. And we do this all the time, all the time. So to answer your question, if the patient doesn't have the pain while I'm examining them, I can't diagnose the pain. So I will make them do things to bring on the pain. Now this happens quite often, at least 10%, 15% of my patients. The patient will say, I'm having pain here, okay? I'll look at the MRI, they got 2 bad discs, 4, 5, 5, 1. And I'll say, do you have any pain up here? Nope. Okay, we'll do their surgery, we'll fix them back here. Their pain goes away here. They come back and now they have pain up here, higher up. And I'll say, oh, you're having pain higher up. It's in a different place. And some of the patients, honestly, they'll get defensive about it. And they'll say, no, it's the same pain it was before. And I'll be, no, it's not. It's in a different location. Then we go and treat that new location and get rid of the pain there. And then they're like, yeah, you're right. So a lot of patients can tell it's a centimeter higher. A lot of patients cannot. So, but in the end, we're patient with them. We figure it out. I've never seen the Deuk laser disc repair fail. I've never seen the Deuk plasma rhizotomy fail. It works as long as you have the right diagnosis.
Last question from B3 is asking, when the nucleus dries up and after a DLDR is done, will the annulus after repair be strong enough to withstand the axial load on the area, and will this make the area more prone to re-herniation?
Well, B3, I don't know who you are, but you asked some really good questions. Thank you. Thank you for everybody, because it's good for people to hear this. So B3 has asked some incredibly insightful questions. The last one is, all right, well, we know that with a normal disc, the disc is a weight-bearing structure. It's supposed to be a bouncy thing, right? With the jelly in the middle, the nucleus absorbing the load, dispersing the load forces laterally to the annulus flexing or bending, and then absorbing that energy, right? And just dissipating it, right? So now you got a tear in the annulus, you got a dried out nucleus, you fix the laser with you fix the annulus. Now the annulus heals. A year later, it's healed. Can the disc still accommodate the normal forces of normal movement and activities of a human body? The answer is yes. How do I know that? Because I've been doing this surgery 16 years. And the patients that I did it for 16, 15, 14, 13, 12, 11, 10 years ago, they're all doing phenomenal. And they're having a normal life, normal activities. They're not just laying around on a couch. So it's a great question, and the answer comes from experience with my patients that had the procedure done. Remember, we've done over 1,600 of these surgeries in the last 16 years. So about 100 a year. And I can tell you from my experience, the people that get it done don't have any problems with their disc doing normal activities. A lot of them go back to weightlifting, water skiing. Shoot, we have people go back to rugby, professional rugby, basketball, right?
Yeah.
So we have them all kinds. Great question.
And that is it.
Wonderful. Thanks for joining us. We'll be back in 30 minutes with a third surgery for today, which is going to be a combo Deuk laser disc repair to fix two bad discs, unpinched nerves, causing leg symptoms. Also, Deuk plasma rhizotomy for facet pain on the right side at 4551. Also, sacroiliac joint rhizotomy by Dr. Patel with the Deuk plasma rhizotomy to fix SI joint pain.
We do another question just been added.
Hold on, and that next patient, by the way, he had a fusion done elsewhere, not by me, and now he's having problems, obviously, below his fusion. Go ahead.
This next question comes from Kit.
Kit.
Apologize. Yes, this comes from Kit, and they ask, how much is a one-level DPR?
All right, Kit, who I assume is Knight Rider's car, is asking us a question, right?
Yeah.
The little red light. Do you know what I'm talking about, Knight Rider? Oh my gosh.
Classic.
Dude.
Yeah, I've seen it.
Right?
I've seen a little bit of it.
Sam, I'm sorry, you're going to have to go watch Knight Rider. There's a reason for it, okay? Everybody thinks that Baywatch was the first time that that actor, what's his name?
Oh my goodness.
Who's the lead male actor in Baywatch?
I'm trying to remember. Oh, David Hasselhoff.
David,
Hasselhoff.
sorry, David, I had a moment.
Senior
moment. So David Hasselhoff, right, Baywatch, everybody knows who I'm talking about. Yeah. They all think that he started with Baywatch, like your generation probably does. But he started with Knight Rider. And that was a TV show that came every week, a new episode. That was amazing. And we all grew up watching it. I grew up watching it. That was like my favorite show to watch. So he's out fighting criminals with his car named Kit.
Yeah.
And his car is like a supercomputer car that can drive itself. So Elon Musk probably got the idea from Knight Rider. Anyway, Kit, to answer your question, and the question was on the cost of a one-level Deuk plasma rhizotomy. I don't have the cost information. It's a great question. I just don't have it. So the way we work here is we typically will do a free MRI review for you, figure out what's wrong, and then tell you what treatment you need. And then I have a team that goes and they have all the pricing information. And if it's a one-level Deuk plasma rhizotomy for your facet, they have that number. I would be guessing, you know, if I told you right now. And I don't want to guess, because then you're going to say, oh, but Dr. Deuk said and I don't want to do that. So I don't deal with numbers anymore. That's the surgery center scheduling team. Any other questions?
That is it.
But I can tell you one thing, it's less than a Deuk laser disc repair. It's a lot less. All right. Thanks. We'll see you soon.